Hi, this is Sanket. I'm a doctor of physical therapist at Core Therapy and Wellness, and today we're fortunate enough to have Dr. Timpthy Pringle here with us. He's a board-certified vascular surgeon and many award holders, Best Patient Choice Award, Top Doctors Award, and he has been practicing in Carrollton and Louisville area for many years. And he's also a founder of the Core Vascular Services. So thank you so much for joining today, and
Thank you.
Just tell us about something.
So, like Sanket said, I'm a vascular surgeon. I specialize in minimally invasive procedures to treat arterial and venous disease. I do my venous work in my office as well, and my arterial disease at the hospital. I also do my own ultrasound to surveillance for arterial and venous disease, which is done in the office. It's actually better done in the office than at an image center or a hospital because it costs less for the patient.
Yeah, definitely. The cost is definitely an issue. Also, not only that, the convenience, right? Because if you go to the hospital urgent care, it takes like hours.
Right.
You know, so
you have to check in, register, and then they may charge you an inpatient cost for an outpatient test, which is can be very expensive. So one thing that we like to do is make it easy for our elderly patients. They don't have to drive to a parking lot and go all the way into the hospital. They can drive up to the office, come in and get their tests. And then it makes it so much easier for them, less stress, anxiety.
Yeah. And then after the procedure, it's a peace of mind.
Right.
You know that what is the result. Like,
exactly. Because not only do we do the testing, I'm an RVT, and like Sanket said, I'm an RVT, which is a registered vascular technologist, and I'm a registered physician vascular interpreter. So not only will I do the test, but I'll explain it to you.
Exactly.
Whereas a tech can't.
Exactly.
They're just a tech.
Yeah, that's a suspense stays there.
Exactly. So it saves a step. You know, I see you. It's a one-stop shop. I see you. I can interpret the test for you. I can show you what the issues are. And additionally, patients will often ask me things that they won't ask the tech because they can't. So I'll scan other areas according to what they're complaining of and see if there's a problem there. And can give them a on-spot, response as opposed to having to wait or not having that address at all.
Yeah, definitely. How long have you been practicing in Dallas, like in the Carrollton area?
I've been in Carrollton since 2010. So I've been in Dallas since 2008.
Okay. So yeah, that's pretty long time. His office is in Carrollton. What is the address of the office?
It is 4541 North Josie Lane, Suite 140. Okay, Carrollton, Texas.
Yep. So and also you can visit his website, Core Vascular.
Core Vascular Services.
Yep.
It's actually being updated. We're doing a whole lot of things there to make it more user friendly. And also, I'll blog at Core Vascular Service on YouTube. That's a Core Vascular Service YouTube channel. And I'll post on Core Vascular Service Instagram or Core Vascular Service Facebook page. So give you multiple ways to see what I'm doing.
Okay, right. Because the reason is not many people are aware of the vascular issues.
Right.
Because I see many times patient comes and I see claudication. It could be vascular claudication or neurological claudication, but they don't know. Like they just blame on the strength that I'm weak.
And claudication, again, is a big word.
Yep.
So the things that we use very gingerly is something that people don't understand what claudication is.
That's true.
With this, we're healthcare providers.
Yeah.
We don't know a whole lot about this IT stuff.
Yeah.
So,
that's true.
So buzzwords, how people really ask the question.
Yes.
So we're learning all this, and some of this podcast. Podcasts and things we're doing is we're learning how to communicate better with the patient.
Exactly.
Additionally, when they bombard us with administrative work, paperwork, and fighting insurance companies. It doesn't allow us the time to educate and teach. So this is free information, so that you can watch it over and over and over again and share with your family members, so you get a better understanding of what we're trying to say in that 15 to 30 minute time you come to the office. So you get to watch it and not be pressured. You can ask questions and different things like that.
Yeah. So what are the common conditions you treat?
Well, let's put it in layman's terms. Pain and swelling, right?
Well, there you go.
Pain and swelling. I think those, either you're going to come in with just pain with no swelling, which can be described as crampy pain when you walk, which is more on the arterial side, or it can develop an ischemic ulcer in your foot that does not heal because you don't have blood flow, which is still on the arterial side of your circulation.
Yes.
And then the other part is the swelling. That can cause pain, but it has swelling. And that's on the venous side of your circulation. And so that has to do with your veins bringing the blood back to your heart. When they fail to work, then the blood pools in your legs and you get swelling, you get itching, burning, numbness, tingling, heaviness, fatigue as the day go on. And then you can develop all these skin changes, like discoloration of the skin, ulcers. Sometimes you can leak out fluid and all these different things. And so it gets complicated. Arterial disease tends to happen faster. Venous disease can happen over years. And like we've discussed before, venous disease doesn't kill you. It's just debilitating. You develop all these symptoms, but you won't die. And it's very difficult for a lot of healthcare providers to describe. And so a lot of times they'll say, hey, you know what? That's normal. You just getting old. That's what tell you,
that's
right?
a very typical response, right?
Or if they're nice, they'll say, hey, you start wearing some compression socks, right? And that's where it's left. One talk I used to give with the emergency department physicians is I always say this question. I say, if you have a patient that comes in the emergency department with a history of swelling in their legs, and you're worried about DVT or the swelling, what do? They do a venous duplex. I said, but when that venous duplex is negative, what do?
That's it, nothing.
No, what they told me is, well, we'll wait a couple weeks and repeat the venous duplex.
Oh, okay.
Well, if it was negative when you did it, it's not a DVT. That's DVT is deep venous thrombosis. Is a clot in your deep system. Those are serious. Why? Because deep system veins run between your muscle. Every time your muscle contracts, it pushes that blood back to your heart. So if you have a clot in those veins, it's going to push the clot back to your heart.
And
in the superficial system, where there are superficial veins, there's no muscle. So the only way that blood gets into the deep system is through one-way valves. So if those valves are not working, then deep system blood can flow out to the superficial system. That's important because you can get clot in the superficial system, but that's treated with warm compress and non-steroidals like Aleve or Advil or ibuprofen. But a clot in the deep system is serious because that can go to your heart. The one in your superficial system, they're not going anywhere. But the one in your deep system can go to your heart. And so that's treated with blood thinners. And depending on if it's gone to your heart, they might put an IVC filter in to try to catch the clot so it doesn't go to your lungs.
So that's a good point about the swelling you mentioned about the deep DVT and all. So many people experience that swelling in the legs. What are the typical signs that you usually look for? That, hey, if you see this kind of signs, most of the time, this is the issue and we can take care of it. So what typical signs you're looking for or symptoms?
Okay, so let's talk about it because swelling can present multiple ways.
Exactly.
Well, let's rule off the most uncommon way. The most uncommon way is lymphedema Praecox or lymphedema Tarda. Okay, that is caused by either poor development of your lymphatics or no development of your lymphatics. And so what happens is those people will present at birth. Or early in life, they'll have massive swelling in their legs because the lymphatics have not been developed. The difference between that swelling and the swelling that we often treat is that it is a non-pitting edema. So the leg is swollen, but when you press on the leg, nothing happens, right? It just stays swollen. Pitting edema, which you see in venous disease, or that's a secondary edema to venous disease, then you press in and you leave an indentation in your skin. So that's the difference. So primary lymphedema Praecox, congenital. Then you got a lymphedema Tarda. Is usually something that comes on in your 30s. And that usually happens after a trauma or something stimulates it, but it overwhelms your lymphatic system because they're poorly developed. And so you get a swelling that is what we call elephantitis. One leg is so much bigger than the other. And so those are the least common types of swelling.
Okay.
What's more common is venous disease. And venous disease occurs over years. Okay? You develop it, it's usually the risk factors of this. It is family history. That's the number one. Any job where you have to stand or sit for long, that's most of us.
That's more of us. Yeah, most
either
of
you're
us.
sitting at a computer or sitting as a secretary or sitting as a teacher or sitting as a bus driver or a truck driver. All these people are at risk for venous disease because they sit all day. Okay, or you're standing as a cashier, standing as a waitress, standing as a doctor and nurse, standing as a marketing person. All these people are at risk for venous disease. So, family history. Any job we have to sit or stand, and it happens over years. It doesn't happen because you just did it one time.
It happens over the year.
Then if you are female and you have 2 or more pregnancies, so the baby is sitting on your venous system for 6 months. The first time you may not show many signs, but at that second time, those valves are really worn down. So you get a lot of swelling.
That's why you get the swelling on the feet.
You get swelling. And so then it's age. Age over 40. So once you get 40, you know, you got the genetics
of the wane
the
gets
genetics coming.
affected.
So that is called that is the primary causes of venous disease, right? The secondary causes is if you've had a clot in your deep system, right? And that's a DVT. And so during the time that that clot has to resolve itself, your superficial veins are carrying the blood. Let's point this out. 90% of the blood should be in your deep system. Only 10% should be in your superficial. So when that clot is healing itself, the 10% veins are now carrying 90%. So they get worked. And so when the clot resolves itself, now those valves are stretched. That's called post-thrombotic syndrome. So these are the ways you can develop venous disease. And it happens over years. It doesn't present acutely or right away. It happens slowly. So some patients will get used to the symptoms. They'll get used to it and they'll say, hey, I'm just getting old. You know, this is normal until they're educated. And I always tell my patients, I said, if I had 100 patients, if I had 100 patients, 70 of the patients will have symptoms and findings. And then 15 of the patients will have all the symptoms and no physical findings. And the other 15% of the patients will have all the physical findings. I mean, hyperpigmentation, everything, swelling.
No symptoms.
And they will swear they're fine. Nothing's wrong. Everything's great.
And that's like, you know, and I understand. See, when I see the patient in physical therapy, like as they age, they accept the changes. And then rather than working on it, they will stop doing the things they enjoy. Like, for example, hiking, walking, playing golf, or like they will just stop doing that because they're getting tired. Their legs are heavier. So, you know, they can't walk more. They can't do certain exercise. But tell me, like, what are the preventative care? Let's talk about, like, you know, people who has a lymphatic, like, you know, lymphedema versus like a venous edema. So what do you, like, you know, what do you suggest, like the prevention care?
The first treatment is compression therapy for both of them. So compression stockings is a maintenance. It's to maintain or control the swelling. But sometimes the swelling gets out of hand. And see, when the swelling gets out of hand, then you have to address it. It depends on, if it's primary lymphedema, then it's mostly physical therapy and manual lymphatic
drainage,
drainage, and then wrapping.
To
maintain that. If it's venous disease, then it's identifying the veins that are not working and treating those veins along with treating the lymphedema that's already there. And the analogy I like to talk is I'm a plumber, right? I'm a human plumber. So basically, you know, if a person comes in with venous disease, the veins get big. And when they get big, they do two things. They leak out protein. Protein draws water. And then they leak out hemocentrin, break down products of blood, and tattoos the skin. Okay? So what we have to do first is stop the root cause, right? So in plumbing, if I had a sink, right, and the faucet was running, and the sink was filling up because the drain is not draining. What's the first thing you do?
Turn off the tap.
You turn the water off. Right. That's the question they ask. You know, a lot of people. What's the first thing? Turn off the water. right?
Yeah.
Because if you don't turn the water off,
It's gonna keep on flowing.
so the first thing, we treat the incompetent veins. We treat those veins and we turn off the water.
Yep.
Because you're stopping the cause of the swelling.
Yeah.
That's the first thing you do. Then you work on the swelling. And some of the things we do is we kind of work on the swelling and turn off the water at the same time. We don't wait.
Yep.
Because your lymphatics, this is important, your lymphatics only designed to drain 20%.
Okay.
Because normally that water is sucked into the vein by the protein. It's called oncotic pressure. It sucks the water into the vein. But when you have venous disease, proteins are leaking out. So now it's sucking the water out into the fatty tissue, which is only designed to drain 20%. So it takes a longer time for those lymphatics to drain that water that's already there.
Yeah.
So once you turn the water off, then you unplug the drain.
Exactly.
So that is compression, leg elevation, manual lymphatic
drainage, proper exercise.
Exactly.
Yep. Yeah. And that's why, like, I think because of that swelling and everything, the people feel pain as well, because all the fluid compress. All these muscles and everything get compressed, and people feel like they get tired easily. Their mobility reduced because with the swelling, your ankle, they can't move your ankle properly.
Right.
They can't put the shoes on. There are so many things that get affected.
Now let's talk about that though. So remember, arteries carry blood away, veins bring the blood back.
Yep.
And so the blood in vein is used up blood. It's deoxygenized blood, right? So it needs to come back to the heart to get oxygen.
Yeah.
So when we correct that circuit, that's more blood that's coming back to the heart.
To the heart, yeah.
That's going to the lungs to get oxygen to pump to the body. And a lot of people feel like they've had a heart bypass. Because imagine, it's amazing how much blood you can pool in your legs over the course of the day. If you're sitting, your heart beats 100,000 times a day. So if you're not moving, if you're not elevating, that blood's not coming back. I had a lady that I was treating, and she was on 80 milligrams of lasix to help, because she had swollen her legs.
Yeah.
But she was also told she had heart failure. But she said, every time I take a lasix, it gives me a urinary tract infection. It dries me out, right? So I treated one leg. And because that increased the volume of blood, she diuresed 2 liters.
Okay.
That means diuresis means you start urinating. So now, where the lasix works? Lasix can't pull water out of your leg. Okay? Lasix works in your kidneys.
Exactly.
So that blood has to come back to your heart, so the heart can pump that blood to your kidneys, and then your kidneys is a filter. If you have excess water, it filters it out. So if that blood is not coming back to your heart, and they give you lasix, well, lasix not going to draw that water. It's only going to get rid of water that's already in your central system being pumped to your heart. So by us returning that blood back to the heart, now that heart failure that they had diagnosed her with is there, and the lasix is doing its job. Because now that blood is being pumped to the kidney, and the kidney said, no, we got too much water, let's get rid of it. And that's amazing, because 2 liters of water that's been extracted from your blood and your kidneys, that's like a heart bypass. Now that fatigue that you had goes away because the blood's coming back. Your fatigue, you've been pumping blood down all day, not coming back to your heart to be pumped to your body. That's why you're tired. It's a lot of things that happen. It's your circuit. Arteries carry blood away. Veins bring the blood back. That's the circuit. If any part of that circuit is broke, you're going to have problems. You're going to have problems. So my job is to find out which part of that circuit is broke. And then fix it. If it's the arteries, I always do. If you come in for venous disease, I do an arterial exam to make sure that your arteries are working. A lot of people say my circulation, I got a circulation problem. That's generically used because they're thinking arteries because that's all we hear about on the news. PAD, which is peripheral arterial disease. But really the problem is the other part of the circuit. Because with PAD, you usually don't get swelling because no blood's getting down there. PAD is usually you get pain,
pale,
pallor, all that kind of thing. So those are the things you get with PAD. If I see swelling and someone says my circuit broke, the first thing I'm thinking is venous disease. I will check to make sure your arteries are functioning, because sometimes 30% of people can have arterial disease, underlying arterial disease, and then you have to determine which one is more symptomatic. Is it the venous or is it the arterial?
Yep.
But that being said, if you have somebody that has a lot of swelling, you got to be thinking venous disease first. And then you kind of, your exam is going to tell you, well, is this primary or is this secondary venous disease? And that really based upon if there's pitting edema. Now, there is one type that's confusing. It's called lipedema. It's water in the fatty tissue.
Yep.
It's non-pitting too, and it usually stops at the ankle. But it can cause symptoms.
Yeah.
You have venous disease cause the symptoms, but then you have the swelling that's more like primary lymphedema.
Yep.
So it's important to identify those patients, because if you treat their venous disease, their symptoms may get better, but their legs don't change. Their legs won't change.
Yep.
It'll be the same size. The treatment of that is liposuction.
Okay.
Or weight loss.
Or weight loss.
Or weight loss. So those are the things, just education, knowing what you can do.
So what do you think the big role, like the diet, exercise, so do they play a big role in prevention?
Diet and exercise plays a big role in all disease.
Agree.
So essentially, diet is the first line of therapy. Nutrition is the first line of therapy to fight disease. Boost your immune system. That's it for our main diseases. Cholesterol, high cholesterol, diabetes, high blood pressure. Those are our main core disease. And off those three, everything flows. Whether cancer flows, or whether kidney problems flow, or heart disease, that all flows off of diabetes, high blood pressure, high cholesterol. How do you control those? Diet. Unless you're genetically predisposed to it, which you can't control, right? Most people have acquired through their diet, through their lifestyle, they acquire disease, which can be managed, could be improved, right? So exercise, and I tell this is what I say. If exercise is a gun, what you put in the body is the bullets.
Well said. Well said.
So you can say, I exercise every time, but if you're eating poison, that's what you circulate.
Exactly. Yeah, well said.
Poison, right? So if you exercise and you eat nutrients, then that's what you circulate. Nutrients, and the nutrients being pumped to the end tissue, end organs, and they cause healing. Right? So you can't exercise disease away. You got your body is a chemistry lab, right? And what you put in the body depends on what product you produce. Right? And we can determine how well you are feeding the body by our labs. We draw labs every 3 months. Look at your blood, and that tells us how good a chemist you are. Right, so you can't lie to us.
Exactly, you can't lie.
Right.
And also, not only lying, you see the symptoms on yourself.
Exactly.
You can tell, the person can tell whether, they're eating well or not. Because I noticed, that when you're eating healthy, you can see the energy.
Right.
And it does affect, overall. So if you want it to be, more healthier side, if you're experiencing with any kind of swelling, edema, definitely it's worth to check it out. You need to find out first what it is, why you're getting the swelling. So don't ignore the symptoms, And that brings me to the question, how early people can get this problem? Because many times the mentality is when they get older, but they think they get older and they get it. But I think that also very well affected in the younger population.
It depends on how strong your family history is.
Okay.
So if your family history is strong, you can get it as a teenager.
Oh, wow, okay.
Right. I think the youngest person I treated for venous disease was 60 years old.
Oh, wow.
And so kids in high school in the marching band and different like that have swelling and legs hurt. And in 2014, there was a push to start screening kids with echoes before they played sports. Because they were worried about the acute arrhythmias that was occurring and missing that diagnosis. So during this particular time, I also recommended doing free ultrasound for venous disease to educate people about venous disease.
Okay.
And I got 20 people assigned. I took my laptop ultrasound to one of the local high schools, and I screened the seniors and juniors and the athletic staff.
Okay.
And it was amazing. I screened 20 people signed up. And the kids came in and they said, I got itching, I got burning, I got numbness. I can't finish track practice. And I'm thinking like, nothing's wrong with you, you know. I'm just here to educate, you know. And so, to my surprise, because they don't teach you in the textbook, when I started scanning everybody, I mean, their veins were dilated 2 or 3 times normal.
Okay.
So, but they didn't have physical findings.
Okay.
But their veins, they had all the symptoms. That's the kids.
Yeah.
But then the coaches came with all the physical findings and swore up and down they didn't have no problems. But they had dilated veins too. And 19 out of 20 people had venous disease.
Oh, wow.
Right.
Does it impact the performance?
It was.
Okay.
And so this was a discussion I had with some of my colleagues. I said, well, you know, I told them what I found. And they said, well, we'll just put them in compression socks. I said, but the thing is, this one guy that I scanned had a scholarship in football in college. What's going to happen when he can't perform? They're going to work up his knees. They're going to work up his hips.
Yeah.
You know, they're going to work up things that will show up in young people.
Exactly.
And then when those are normal, they're going to say he's lazy. And really, he's got a circuit problem. I said, if you had a hernia, would you fix that? Oh, yeah. If you had a knee scope, would you fix that? Why wouldn't you fix his venous disease?
Yeah.
Those veins he can't use anyway. They're not working, right? And they're hurting right now.
Yep.
And so that's the one thing I learned by taking the laptop to the community, because what it tells me is that there's a lot of venous disease out there, but people are not coming in because they don't know.
Yep.
They don't even know they have a problem. They're being told, oh, this is normal, don't worry about it, different things like that. But it's really not. You know, when your circuit is broke, it affects you, whether it's the arterial circuit or the venous circuit. And in my elderly people, I take care of them a lot. I tell them this all the time. People don't wake up in the morning and say, I just want to sit in this chair all day.
Yes.
I just want to sit in this chair. I don't want to move. I just want to sit here for 10 hours a day and then go to bed. If they're doing that, there's a reason. Just like you said, you know, I said they find reasons to stop doing things that they like, you know, because they don't want to feel the pain.
Exactly.
Right?
Yep.
And fear paralyzes.
Yeah.
So they fear that, oh, you got to do some big procedure or something like that, and I don't want that. When these procedures are done in the office and you're awake and done in a local, and I have family members sit there while I'm doing it.
Yeah.
So it's very easy transitional procedure.
Yeah.
And I want you to walk in that day.
Yeah, and I have, like, you know, I have seen some of the patients right next day or day after the procedure.
Right.
So they're pretty active after that. So it's pretty normal procedure.
The most important thing is as you get older, you know, you don't want to stop exercising.
Exactly.
You don't want to stop walking, you know, because when you don't walk and we don't exercise, your blood becomes stagnant and it clots. And clotted blood is not compatible with life.
Yep.
And that's why we have a saying, we keep it flowing. Like,
Keep it flowing.
Yeah, keep it flowing,
Yeah.
keep the blood flowing.
Yeah.
As long as the blood is flowing, you have life, you have
Yeah.
energy, you have activity, you want to live. When that blood stops flowing,
Yeah, that's the problem. And I have a real example. Like, you know, recently there was one of the mutual patients, and it was surprised, like, you know, that after some times, like, the people get happy. Like, she was able to put the normal shoes.
right?
You know, so she was so happy because you know she can't put the regular shoes because of the size of the ankle.
Right.
And then when people can do those kind of small things, because you don't know what you're missing. Like, you know, you get so adapted
Right.
and then accepted, okay, this is what it is, then you don't know what you're missing. But once you realize that, oh, I can do this, oh, I can manage the stairs,
Right.
oh, I can walk more, or I can wear normal clothes. You know, so those are the huge things. So I would definitely suggest, like, whenever you have any symptoms, it's better to check it out, you know, just to make sure that what you have and get the proper guidance. And that is the whole reason we're doing this talk, to get the education, you know, so you guys can understand what are the signs and symptoms you should look for and when to reach out to Dr. Pringle or to, like, you know, any like physical therapist. So that brings me to also, when do you refer to physical therapy? When someone needs to see physical therapy, or like not only physical therapy, the people who does the manual drainage, like we do the manual drainage technique, the lymphedema management. So when you refer those patients to the manual drainage?
Pretty much anybody that comes to my office has extensive swelling. You
Okay.
know, right from the start. You know, because that takes a longer time
Yeah.
to see results. I mean, it takes dedication, right?
Compression, elevation, exercise, manual drainage, diet,
dedication.
dedication.
Right? And I tell people, you know, you can't do it one time again.
Yeah.
You know, it's just going to be a miracle. No, it happens slowly over time. Because, like I said, those lymphatics are only designed to drain 20%.
Yep.
And the people who have the best results, they do it just like we tell them to do it, and they stay persistent. You know, don't blow off days. They don't do it just at nighttime. They do it in the beginning and night. Some people even do it 3 times a day.
Yep.
Right. And so dedication is the key
Yep.
to your results. And don't let fear paralyze you, because a lot of stuff we do through a needle stick, and manual massage actually feels good.
Yeah, that's true.
Think about it.
And I think, like, you're also using, like, all the high-end technologies, like laser and everything, right?
Right,
So I think it's like, you don't feel much.
Right.
All the procedures, it's a quick procedure, and but gives you a lot of results.
It changes your life around.
Yep.
It changes life around. And I think we make better decisions when we know more. That's why we're doing these
exactly.
educational sessions. You know, fear paralyzed. We want to get that out the way. And being able to share these videos with family members, or share with your son or daughter who can discuss it with you and see if it's the best care plan. It's beneficial, because sometimes when you come to the doctor, you're all by yourself.
Yeah.
Right?
Yeah.
So being able to discuss it with others and see how other people are managing and handle it is helpful.
Yeah.
It's helpful. So yeah, we work together a lot. You know, anybody that comes into my office that has swelling in their legs, or even if they have pinched nerves in their back, or issues like that, I refer them over.
Yep.
Because they do an excellent job here at lymphatic massage and physical therapy. I mean, I've come in here and seen patients 60 or 70 years old balancing on a ball.
Yes, they do.
I mean, it's just amazing. So, it's impressive. And that's what you want, you know, because you want to live till you die.
Exactly.
You don't want to exist.
Yeah. It doesn't matter how long you live. I think it matters
The quality.
Quality. How you enjoy your life.
Right.
So yeah, you got to take the precautions. You got to make sure you do the right thing. And
Right.
Yeah, thank you so much. There was a lot of information, and I hopefully you guys find it very helpful, and I hope this helps you to make a right decision. Dr. Pringle, can you share your information? So if they need to reach out to you, how they can reach out to you?
Oh, my office number is 972-906-1055. Our address is 4541 North Josie Lane, Suite 140, Carrollton, Texas. We're right in the back, next to SureCure. So you see SureCure off the road, and then we're right next door to them. That's where you can meet you, or you can reach us at office@PringleVascular1.com. That's the number 1, office@PringleVascular1.com.
Okay, all right. So thank you so much for coming and sharing all the information, and definitely it was very informative.
Thank you.
So I appreciate coming, and sharing all the information. Okay.
It's been a pleasure.
All right. Thank you.
Thank you.